Welcome back. Parents have been reluctant to take their kids to doctors' offices amid the coronavirus pandemic, prohibiting kids from getting their necessary vaccines. There's been a 63% decline in children's vaccinations just in New York City, which could cause more deadly outbreaks. Dr. Dyan Hes, pediatrician and medical director of Gramercy Pediatrics, is joining us to explain how this could be a big problem for parents and kids when school starts back up in the fall, not only in New York, but across the country. Dr. Hes, welcome back to the show. We always love talking to you. Let's dive in. If schools do open up this September, how important is it for kids to follow a vaccination schedule and get the proper immunization while we're going through a pandemic?
Well, I think even regardless if school doesn't start up, because that might happen, the kids have to be vaccinated because we're going to have massive outbreaks of other vaccine preventable illnesses like measles, mumps, pertussis, which is whooping cough. The kids have to be vaccinated. What we did in our office last week was any doctor that works in the 5 boroughs can log into the city immunization registry, and we can send via text blast text messages to our patients who are not up to date on their vaccines. So I can tell you that we logged into the city registry and it really worked. We got so many patients in this week to get vaccinated. We had to give them reassurance that we're seeing one patient at a time, that our office is being cleaned between patients, but that the ramifications of not having the vaccinations is going to be much worse. And most parents were really grateful that we started that conversation.
Sure, that is encouraging news, Dr. Hess. And we know that New York has seen cases of children falling ill with what's being called pediatric multi-system inflammatory syndrome, or MISC, related to the coronavirus. So, doctor, could getting vaccinated for other diseases like measles, as you mentioned, lower the threat of contracting COVID?
Well, there is some discussion that the MMR vaccine, the rubella component of the MMR vaccine, might have about 20% similarity in the genetic makeup of COVID, and there are investigations going on to see whether the MMR is offering any type of protection against COVID because of that commonality in the genome. But we don't have hard proof of that. But we do know the numbers are lower in children, and if they're up to date on their vaccines, they have the MMR vaccine. The same thing with healthcare workers. We often get a booster of the MMR, so maybe that's providing us some extra immunity, but that hasn't been proven yet. It's just a theory.
Talk to me about the implications and potential dangers, doctor, of this drastic drop in vaccinations and the effect it will have in the resurfacing of other deadly illnesses while we're in the middle of a pandemic.
Well, just like we saw with the measles just the past fall, if we have measles outbreak, communities are going to be on lockdown again. So we're just creating another problem. We want to have the healthiest children we can to go back to school. And I think if you're a pro-vaccine parent and you believe that vaccines work and your doctor's office is reaching out to you and providing a safe way to get a vaccine, you can do most of the well visit on the phone, and then you can just come in for your vaccines. We are desperate for our patients to be vaccinated. What's happening in New York City is that most of our patients have left, a lot of our patients have left town. So what we do every day is we're sending our vaccination records to doctors in New Jersey or California or Oregon, wherever our patients are, so they can be vaccinated.
I'm sure that makes the lives of many parents easier, Dr. Hess. And you mentioned most of your patients are open to bringing their children in and getting vaccinated. But for those parents who are a little worried to get their kids vaccinated and are nervous about coming in to see a pediatrician, when is the best time to get vaccinated? How do we ease those fears?
Well, our office personally, we're offering home visits out east in Long Island and also in New York City for the parents who are really afraid to come to the office. And we did 3 just the other day, and the parents were really appreciative. But I think it's just about discussion. It's about, whooping cough is still out there. Polio has resurged in other countries. We had measles and we had mumps in the U.S. this year. We have to discuss that those are deadly diseases and they have long-term effects on your child. You don't want measles encephalitis, you want death, blindness. We have to remind them. And I think if you have a good open line of communication with your patients, you can have a very fruitful conversation about it.
Crucial information. Dr. Dyan Hes, pediatrician and medical director of Gramercy Pediatrics. Thank you so much, Dr. Hes, for being on the show.